Dear viewer, good evening and welcome to Med Chat. With us tonight, Dr. Raed Alnajjar from Henry Ford. Dr. Alnajjar, welcome to MEA.
Thank you so much for having me here today.
Thank you. Dr. Alnajjar, if you tell me about yourself, where you went to school, and I believe you are from Jordan, what you were doing in Jordan, you were a doctor in Jordan or not, and your family and all that. So we'll start with the education.
So yeah, I was born in Jordan. I did my medical school in Jordan.
Okay.
And then I did actually surgical training in Jordan. Then I worked in Jordan in the Middle East for about a year and a half. During that, I was also certified by the Royal College of Surgeons from Ireland. During that time, I always have the dream to come to US to do cardiac surgery. So that was my mission from the second year when I was in the medical school. And then because of that, you know, it's not easy for the foreign medical graduates to come to the US. And it took me a while to be able to get to United States, and came over, did surgical training again, and then cardiac surgery training. I did actually the surgical training here in Michigan. And then I went to Texas Heart, Baylor, and College of Medicine in Houston for the cardiac surgery. And then after that, I worked in Kentucky for 3 years. Then I came back to Michigan, which I consider home.
It is a home, with the food, with the culture, with everything.
Yes, it's a home. So I've been with Henry Ford since 2016.
Yeah, doctor, when you came to United States, you had to do more study to get to balance your graduation or your diploma or whatever you call it in Jordan.
No, the medical school training is already well certified.
You don't have to go through exam or
you do exams. You do exams,
okay.
And then once you get the certifications to be able to practice in the United States.
How long it take? I'm asking you this because there is a lot of family and a friend in the United States, and we broadcast in every state in the nation. They have family or a friend in Jordan or Syria or Egypt. They are doctors, and they would love to come here. So if you give me just 2 minutes, how you did that?
I think the first thing is that you do the United States medical licensing exams. I think it's
first you
now.
get the I-20 visa, right?
Yeah, you get the visa,
yeah.
But you can actually do the exams in the Middle East.
Oh, in the Middle East.
I think they are doing them in Jordan, they're doing them in Turkey, they're doing them in Egypt. And there are multiple centers in the world where you can actually go, because the exam right now is computer-based exam. So you go sit for 8 hours, you do the exams.
Yes.
There's part 1, part 2. Then part 3, or the clinical skills, you come to United States for the exam. And then once you do these 3, they give you the issue.
So there is a process.
There is a process,
yeah. Go ahead, yeah.
And it takes between 1 to 2 years.
1 to 2 years to be able to practice medical in U.S.
So, but my advice to somebody who want to come here, start early. When we are in the medical school, you can actually do the exam before you graduate. So by the time you graduate, you time it, you finish, you don't have to waste a year or something. You're already ready to get to the residency here.
I see. Can we talk about the family?
Yeah, I am married, have 3 kids.
Yeah,
They're grown up right
young
now.
or?
No, my daughter is in University of Michigan. She's a senior. And I have, my son is a senior in the high school. And I have Talia, who's 9 years old.
God bless him. God bless him.
And my wife is, she originally, she's from Jordan. She was a nurse there. And she came here and she did nurse practitioner now. So now she actually graduating this year as a nurse practitioner, which is like advanced practitioners. They can actually practice medicine independently.
And hopefully she'll work for Henry Ford.
I hope so.
Okay, doctor, let's talk about your profession. Okay, what's your position in Henry Ford? And I believe you are specialized in lung cancer, and we're going to talk a lot about this. But tell me your position in Henry Ford and how long you've been with Henry Ford.
So I've been with Henry Ford since 2016.
Okay.
I'm currently the director of cardiothoracic surgery department at Henry Ford Macomb.
Okay.
Where is the bulk of my practice, about 75%. and about 25% of my practice, I'm a practicing cardiac surgeon and thoracic surgeon at Henry Ford, Maine. Also, I have privilege to work at Henry Ford West Bloomfield, so I go to the three of them. But my main bulk is Henry Ford Macomb.
You cater to a lot of Middle Eastern community,
Yes.
both in Oakland and Macomb.
Yes.
Yes, go
And
ahead.
also, I am a core faculty for the General Surgery Residency Program at Henry Ford Macomb, which is affiliated with Michigan State University.
Okay. Doctor, let's talk about the lung cancer. And one of the cancer that's very famous is one of them is the lung, the pancreas, and the prostate. And the lung is very important because within the Middle Eastern community, a lot of people smoke cigarette, men and women, of course, and young, and all too, smoke cigarette. And we have the hookah, and the hookah places everywhere where there's a Middle Eastern community. Tell me about the cancer, and if you could tell me how somebody could feel that he's got the cancer coming. And then we'll talk about the cancer itself and how we treat with it.
So first of all, lung cancer is one of the most common cancers, or probably the top 3, in both actually men and women.
Yes.
And it's actually one of the most lethal cancers. And the main reason for that is, in addition to many other reasons, is smoking, obviously.
Okay.
It is the problem with lung cancer over many, many years. There was nothing much in terms of the detection and management. Unfortunately, most of the patients, if they come to us with symptoms, that means your lung cancer is stage 3 or stage 4, which is a really advanced stage, and it's bad.
Yeah.
Which means,
I mean, when you reach 4th stage, the percentage of you dying, good percentage.
In late-term language, you're living between 6 months to 2 years.
That's right.
And that's when you have symptoms. So that's what
how somebody could feel that he's got symptoms. What will happen to him? Will he have enough sleep, shaking, losing weight? What's
usually the main symptoms of lung cancer.
And doctor, you could mix the Arabic with the English, so people, they, نعم. التدخين طبعا.
التدخين هو I think the main symptoms, يعني الأعراض the main symptoms for patients.
Yes.
When they come from the lung cancer, either السعال, the cough, that's the main thing, coughing, blood,
blood,
سعال, الدم, shortness of breath, ضيق النفس, and chest pain. Okay, in addition to that, you add weight loss, anorexia, you're not eating, you're feeling fatigued, you're feeling tired.
Okay.
So these are
the
main
some
symptoms.
people, they do, that system is in their body, and they think they have a cold, or they have, influenza or something.
Yeah.
Tell me how I make the difference.
That's the main challenge we have in lung cancer, is that most of the patients, when they have the symptoms, when you start coughing or you're feeling sick, you're going to say, I have a flu, or maybe I have a... And so most of the time, you go to your physician, and a lot of the time...
Sometimes you don't go. Or you take vitamin D and C and, zinc.
Yes.
And,
or if you have antibiotics here and there, some people, they take antibiotics, which is wrong. But the problem is that if every single person who comes and start coughing, you're going to screen them for cancer, it's also a huge burden on the healthcare.
Of course.
So most of the time, for the first 2-3 weeks, they're having symptoms. And sometimes, actually, as you said, they don't even show up to the physician. They're just going to say, I had a flu.
It's a cold, I had flu,
It's going to take a while, specifically
I
these
take
days.
if I have D and C and zinc, I could kill it.
Yeah, and specifically these days with COVID, patients' access to the physicians and healthcare is limited. And people also get concerned. I do want to go to the hospital. I do want to go to the emergency room. I do want to get COVID infection. So people are hesitant. So they stay home. They don't come. They don't seek medical advice, and they come back after. I've seen recently patients 6 months of coughing and shortness of breath, and I say, "How you been like this?" Well, I thought it's going to get better, and then eventually it did not get better.
No. Okay. You said even bleeding, cough, bleeding, and all that. What caused that? I mean, I know it's smoking, but what caused that smoking to get your lung so bad and have the cancer there?
So, you know, there are many theories, but obviously cancer, smoking specifically, goes to the lung cancer cells,
Okay.
to the lung cells, and actually
Infection
destroy them
Okay, yeah,
and change the genes there.
because I want them understand
Yeah.
what happened to him. Yeah.
You know, so that basically what it is, you know, the exposure, the continuous exposure to the smoking and the carcinogenic materials in the smoke. You know, بالدخان in the cigar, there is many toxins and substances that
How about secondhand smoking? If
It's
I
the
said to
same.
somebody and keep smoking,
It's
I'm
the
getting
same.
some of that.
It's
Yeah.
the same. It's
Yeah.
actually, you know, you are exposing yourself to significant risk, like the same one who actually smoking.
I see. What should I do to prevent that? Quit smoking, or I have to do more?
So-
Because my body, my lung is bad.
I think the key is prevention to start with.
Okay.
So if you never smoked, don't try to get to that habit.
Yes.
If you smoke, try to quit. I know it's not easy. I know it's easy to say, hard to do.
Yes.
But I think, and I know that I talk to this every single day with my patients, whether they are coming for heart problems or lung problems. And a significant amount of the patient, they say, well, we cannot quit. I cannot quit. And I always tell them it's in your brain. If you
Of
decide
course.
to quit,
Yeah.
you will. It's all about your determination. I know people get patches to help.
Yes.
There are some groups together. There are a lot of support you can help. And there is a lot of help in terms of smoking cessation. But at the end of the day, it's your determination. Once you decide, you will decide. And if something like lung cancer will not scare you, then what else gonna?
Of course. Is
Take-
exercise and eating healthy at help?
Of course, exercise help, eating healthy helps. All these are important factors. Having a good immunity, good proteins and vitamins always help. But
No.
again, the main risk factor is the smoking.
Smoking. If somebody have a stage 1 and he came to you after he feeling like he's coughing and all that, what's the treatment?
So just to say that, usually stage 1, they don't come to us because they don't have symptoms. And that's the most important key. And that's the most important point, I think, if anybody want to take from this, is the lung screening. So people who are smoking, and there are protocols and guidelines that are approved by the CMS, by the Medicare, Medicaid, and all insurance companies.
Good.
If you smoke for certain years, specifically more than 30 plus or 25 years or 25 packs per year, then you're eligible to do what we call lung screening CT scan.
Is his
which is-
family doctor could do that?
Yes, any
Okay.
family, and I encourage patients to ask their family doctor about this low dose lung screening. So you go into the CAT scan, it's a quick CT scan, and it will pick up small spots, or in our terms, call them nodules, or small masses in the lung. So those, if we pick them up early, i.e. they are stage 1,
Yes.
and if I catch somebody as a stage 1, then I take that part of the lung, then definitely that is the best treatment and the prognosis is great.
Great. Stage 2, stage 3.
Stage 2 still, it's actually, I think, it's not as bad. You know, you do the surgery, but you need to follow up with some chemotherapy and sometimes radiation. I mean, as long as you get lung cancer in stage 1, stage 2, you're in a good hands.
Okay.
When you move to stage 3 and 4, that's where become our care, you know, is limited for what we have for lung cancer.
Even with the surgery and taking the bad cells out, he's still, or
Usually when you are to stage 3 and 4, we don't offer surgery because that means the cancer cells are already spreading out from the lung. So doing the surgery is not going to make a difference.
so what's the treatment? If
The
he's in
treatment is
three-
chemotherapy
Chemo
and
and-
radiation.
I see.
And of course, nowadays we have the immunotherapy. We have multiple new modalities. They are under trials. And I'm very optimistic that we're going to have much better
Advance,
good outcome from those treatments, but we're still in, it's too early to decide. But the gold standard treatment for lung cancer, if you are stage 1 or 2, is surgery. And that's actually what makes a difference, because you take the cancer out.
Okay. If somebody have stage 1, stage 2 cancer, could the cancer goes to different part of your body?
Not
For
in
example,
stage 1,
the
stage
stomach.
2.
Okay.
Not in stage 1.
When that will
So lung cancer has 4 stages.
Okay.
Stage 1, when it's confined to the lung, I'm just going to make it easy because there are a lot of details about it. Stage 2, when it goes to the lymph nodes, which are close to the lobe. Stage 3, when it goes to the major lymph node in the chest. Stage 4, when it goes somewhere else in the body, like the bone, the liver, the brain. These are the main 3 organs.
Stomach and
yeah, whenever it goes there, and it becomes stage 4.
I see. So I'm going to talk because there is something happening a lot. Marijuana. Smoking marijuana, and it's and using the drugs, and it's thanks God to open border and a lot of fentanyl and all kind of drugs coming. And we're losing a lot of our young people. Okay, let's talk about marijuana and how could it affect the lungs and all that.
It definitely affects the lung in a bad way. And now we don't know the long-term effect of smoking marijuana because it was not studied for many years. You remember smoking? We've been knowing about smoking since more than 30-40 years. So marijuana is new to the field now, specifically smoking marijuana.
But definitely affect the brain and go ahead.
It does affect the lung, and actually I've seen a lot of patients who are really young who came coughing up blood and have what we call it infiltrates in both lungs, or in lay terms, your lung is almost whited out, which means you're not able to breathe or exchange oxygen through it. And they get really sick in the hospital, and then sometimes it's with infection. Who are not doing well. And a lot of them are young patients.
That's the problem. And let's talk about something very popular with the community, is the hookah. And what they have in that, what you call the masa, I call it the mix, what they put in it, and then charcoal on top. And charcoal is all, it's poison. So please, if you could, doctor, give me more than 2 minutes about this, because a lot of our young people, they smoke it every day, and sometimes twice and 3 times a day.
So I think hookah or argile in our language, it's to me.
You could do it in Arabic because this is important.
أعتقد إنه هاي أخطر من الدخان.
صح.
I don't think I have a lot of ما عندي دراسات to prove that. بس الفرق إنه when you smoke, you're gonna smoke, let's say 1 pack, 20 cigarettes, 2 packs per day. So what you're smoking. بس الفرق إنه when you smoke, you're gonna smoke, let's say 1 pack, 20 cigarettes, 2 packs per day. So what you're smoking. But when you do hookah, you don't know how much you do it. I know, don't quote me for that, but I know there was a study from Boston that they talked about if you smoke 1 hour hookah, it equals around something like 70 cigarettes. I don't know the exact number. So almost
3 to 4 pack of cigarettes. Within 1 hour.
Of 1 hour. The problem with hookah is like it comes with a socialization. People are gathering and they put the hookah and they keep smoking it for an hour, 2 hours, 3 hours. So the effect of that is huge. You're smoking this for a long time, and there is no control of the amount of nicotine, amount of all these toxic material that gets into your lungs. So I do believe, unfortunately, I hope I am wrong, but I do believe like in the next 20 years, we're going to have a huge increase in the lung cancer, specifically in the Middle Eastern communities, because they are heavy in hookah.
And it's growing.
It's growing, and
Yeah,
unfortunately,
everywhere,
it's not only. It used to be more with the guys. Now it's
Oh,
both sexes,
absolutely.
males
Both
and
male and
females,
female, yeah.
women and men are all equally taking having hookah in the family, and sometimes the whole family is doing it, which is
That's
even
right.
more dangerous.
Yes. I know you came from Jordan, and hookah is very popular in the Arab world. Did they did a study there about how that hookah affecting?
Unfortunately, I don't think there is a lot of studies. I'm actually, I'm in the process of doing a study about the hookah. So, but I
Yes.
think it will take 3-4 years before we get some results from that.
I see. Doctor, are you specialized in different cancer than the lungs?
So I mainly do the the cancer of the lung, and any benign or um, malignant disease of the lung, or in the chest wall, or the heart.
I see.
So anything above the diaphragm.
So the heart, uh, and again, this is everywhere, you know. It's one of the disease that popular, not just Middle Eastern community, but the whole community. Okay, how you could avoid that?
I mean, the main thing is to avoid the risk factors. I mean, you have avoiding the risk factors, prevention, and seeing your physician, your primary care every year or so. Avoiding factors, you know, if you're talking about cardiovascular, you know, problems in the heart, you know, heart attacks,
Yes.
blockages.
Uh-huh.
The main thing is the risk factors, your blood pressure, your blood sugar, so hypertension and diabetes, الضغط والسكري بلغتنا,
نعم.
which is the most important.
السمنة.
السمنة
نعم.
number 3 اللي هو you translate it the cholesterol,
نعم.
which translate to what you eat every day. Eat healthy food.
Do you think we should eat the organic الأكل الطبيعي?
Definitely الأكل الطبيعي أحسن, you know, مفيد جدا.
نعم.
The Middle Eastern food actually is good when you do it with less زيت and سمنة and all of these factors. Actually, the Middle Eastern food in a good proportion.
The olive oil and, you know.
Yeah, it should be good. And also smoking. So if you avoid these risk factors, of course, there are risk factors that you cannot modify, which is, for example, our family history, your genes. You know, if you have a strong family history of...
What's the percentage of the gene?
It depends. It's all about how many. I mean, you know, for example, if you have a first-degree relative, if, for example, your parents or your brother, sister have blockages in their heart, then your risk is high. If they have high blood pressure, their risk is high.
And if you have multiple, like two
If you have
sisters
multiple,
or two brother and sister have them,
that's add to it.
that.
Yeah, definitely.
What should I do if my brother or sister have that?
Well, you have to be extra careful. I think you have to start your detection early, specifically if one of your family member have the disease early. For example, if you have somebody who has a blockage in their heart when they are 40 years old, then your risk is really significant. So you want to start at age of 40, check with your primary care physicians. If you smoke, stop smoking. Exercise, eat healthy, avoid cholesterol. And I know I don't want to say it for everybody, but I think aspirin sometimes is important, but I will leave that to the primary care physician, because, you know, you want to make sure when to start taking aspirin. Sometimes they talk about age of 50. You know, I will leave it for, you know, for somebody, and the advice is talk to your primary care physician, and if they strongly believe you need to be on aspirin, then that's important.
Doctor, there's a lot of people, I'm one of them. I take omega-3, I take vitamin D, C, zinc, you know, and I take about 6-7 pills, you know, every day. Is that a help, or eating healthy more help than the pills?
I think eating healthy is more important. Vitamins.
A lot of people, they don't. I take vitamin and all that, but I don't, you know.
Yeah, I mean, I call it trying to cheat. The easy way is like, okay, I'm going to do everything, but I'm taking vitamins. That usually doesn't work all the time. So vitamins are important, but if you definitely eat healthy and control the amount of sugar, carbohydrate, and cholesterol in your food, then you don't need to take all these vitamins.
And we have the Middle Eastern, the rice and the bread and all that, and that carbohydrate, it turned to sugar and milk.
That's the most important thing. A lot of, I mean, we definitely, I personally, we all love bread, we all love rice, but you have to make it, you have to take moderate amounts.
Yes.
And that's where I think the key.
I see. Doctor, at the end, we talked a lot about how to prevent the sickness or whatever happened to your body. But I want you, please, and I want to concentrate in this, the hookah, because it's a major. Give me 2 minutes. Why should I stop tomorrow? And why should I stop tomorrow? Give me that reason, your advice to them, that the effect of the hookah and the whole body, not just the brain and the lungs and all that.
Well, maybe I'll give you an example of many patients that came to me, stories. I mean, not a specific story, but a patient who's, let's say, he's 50 years old, he has been coughing and short of breath for the last 2 or 3 months. He comes to the ER, and then they do a CAT scan on him, and they found this big mass in the lung, end up in my office.
Mm-hmm.
He's stage 3 or stage 4 lung cancer.
And probably all from that hookah.
Yeah.
Yes.
So I do the biopsy, and then seriously, the day when I have to sit down with him, and sometimes he bring his family, and sometimes he has young kids,
mm-hmm.
and he is all.
And they all
full.
smoke hookah.
They all smoke, but he has a full. He come to this country. He has ambition. He want to live. He want to grow his family. He want to see his grandkids, and he want to be successful.
Yes.
And all of a sudden, right now, he's sitting in front of me. I'm telling him, you have stage 3 or stage 4 lung cancer,
mm-hmm.
and you're probably not gonna be here for the next 6 months to 2 years. Imagine.
Please relay this message to the young people. That
yes, imagine this moment that it could be you, if you are a hookah smoker or a smoker, at any single moment of your life, it could be you. You're sitting in front of a physician who's telling you, you probably have 6 months to 2 years to live.
mm-hmm.
What would you do at that point? And I think that's the most
probably
important.
Too late at that time.
Yes.
Yeah.
And then they start, at that point, you see how much, it's important, and they start to realize how much they're missing, how much they're going to miss their kids, their family, and basically your life is going to end.
That's right.
So
well,
that's the most important thing.
Yeah. Doctor, thank you so much for all that information. And those information, it's very, very important. Yes, we cater to the Middle Eastern community, and everything you talked about, it's hitting the community. And thanks so much for the information you've given us.
Oh, thank you so much. I really appreciate you you inviting me here. And as I said, we're always available for help. As I said, at Henry Ford Health, we have the full spectrum of treating lung cancer. That's the main subject
Yes.
we talk about today. We have all the technology, from the robots, from the diagnosis, early lung cancer screening. If you get to any of the sites around the state of Michigan, you will have the best care for lung cancer.
Thank you so much.
You're welcome.
Sure.
Thank you.
Thank you, Doctor. Dear viewer, that was my interview with Dr. Raed Alnajjar. And he talked a lot about the lung cancer. And the Middle Eastern community, and this is my message to them, I know a lot of them, they eating healthy. Of course, men and women, and young people too. They eat healthy. But there is the major problem of a smoking cigarette, and especially hookah. And all the chemical that's inside that cigarette and inside that hookah. And you listen to the doctor, and he said sometimes they came to me with 4 stages, and I don't want to tell them, but they have only six months to a year to live. Don't do that. Listen to the doctor, because that's the future of many, many people that smoke the hookah. So please take this advice. And of course, this interview is going to go to our YouTube channel, and you could go to a YouTube channel if you miss it, and tell everybody, friend and family, that they could watch that in YouTube channel, and they get that advice from Dr. Raed Alnajjar with Henry Ford Hospital. Thanks for watching, and good night.